Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, blowout fracture. Right. In the blowout fracture, actually, there is a fracture of the orbital floor will occur mainly due to any reason. Actually, when a striking object of more than 5 centimeters in diameter, like a tennis ball or a fist, whenever this will strike the orbit, this will increase the orbital pressure, which will result in the fracture of the floor of orbit. So these blowout fractures are of two types. One, we have pure blowout fracture. In pure blowout fracture, it does not involve the orbital rim. Orbital rim is normal, whereas in impure blowout fracture, in pure blowout fracture, it will involve the orbital rim. So these are the pure and impure type of blowout fracture.
thank you and thank you for watching.